It's Dr. Chris with Texas Chiro Health, back with you guys for our 12 Minutes to Health. Thank you guys for joining us each and every week to find out what the research has to say about how you can live your healthiest life, achieve being at a level of homeostasis, and all by just eating well, moving well, and thinking well, right? So we dig into the research each and every week for you guys, the real research that's out there, the peer-reviewed medical journals, and the research inside of those that are the randomized controlled trials or the reviews of the randomized controlled trials that have been tested against placebos, that have been put into these trials so they can control everything and actually get an answer to how to truly be healthy and see what kind of impacts diet and what we're putting into our body has on your health, and then what stress does to your health, and then also movement and exercise. And for us, those are the three major tenets of health. So we like to dig into that stuff, give you guys an evidence-based approach to being healthy and reaching homeostasis. As always, I invite you guys to come into the office Tuesday nights at 6 p.m. We do what we call our special consult in the office, where we go through this research in person. We have the doctors there in the clinic. They get to answer all your questions. We have snacks, healthy snacks, green smoothies, refreshments, things for you guys to enjoy it, and the research there so you can grab it and take it home and read through it and get more than you get in just the 12 minutes. I love doing this for you guys. It's one of my major passions, one of my why I do what I do type things, is that I want to give you this information and I want people to be healthier. And that's why I ask you guys to share this stuff as well. It'd be like me doing this for you guys, but not giving the information to my family. And that doesn't make very much sense. So if you find this information useful, please pass it on through social media. We post it on social media so you can share it from there. You can like it, all that good stuff that just helps get the word out. Because I really appreciate when you guys help us get the word out. And that's what this is all about, is helping people live a healthier lifestyle closer to homeostasis. So again, join us on Tuesday nights at 6 p.m. in the clinics and get your questions answered. And if you have any questions here tonight, write them down, reach out to us through social media, email, texting, calling the office, whatever it may be. Just make sure you get the answers that you need so that you and your family and your friends can be happy and healthy and live a life close to homeostasis. So looking at tonight's research article, it's done by Roberts and Bernard, and it's called The Effects of Exercise and Diet on Chronic Disease. All right, so this is a review of the literature. They go through and they look at all these studies that have been done, and they're combining, exercise and diet and putting that together. And I like that because it takes two of our three, tenets to health: eat well, move well, just leaving out the think well. We have enough information on think well if you've watched other 12 Minutes to Health as well. So let's dig into this one, though, because we've only got 12 minutes here. But I first want to talk about rocks in your backpack. And I've done this a lot, so a lot of you guys have heard this analogy. I'll try to shorten it up, but I want to get everything in for those who haven't heard it yet. So the rocks in your backpack analogy is referring to allostasis. And allostasis, or our allostatic load, is what we're doing that is putting stress on our internal environment, taking us further away from homeostasis, right? So what are those stressors? The stressors are represented by the rocks in the backpack. And as you can see from the photo, the more rocks you get in the backpack, the harder it is to stay afloat. And vice versa, right? The less rocks you have in there, the easier it is to stay afloat. Now, the good news is once a rock goes in, you can get it out. Right? We can do positive things for our health to remove those rocks. And we don't have to put as many rocks into the backpack as we do. So the stressors can come from anything. It can come from eating too many cheeseburgers. It can come from sitting around all day and not getting enough exercise, being chronically stressed out, the inflammation that we see, side effects from different things that we do create rocks in our backpack. So it's important to understand that, because what this study is looking at is exercise removing rocks and good dietary habits removing rocks. So that's what we're going to be focusing on tonight and seeing the benefits of those. Let's first talk about your genes, right? Because a lot of people feel that they are genetically predisposed to fill in the blank: cancer, diabetes, heart disease, autoimmune disorders, all of these things. And so what this research article did is it said, let's dig into it. What they found, right? They looked at the 20th century, and you can read the quote here, but there's been 100% increase in type 2 diabetes in the second half of the 20th century. Now, guys, I promise you, your genes have not changed one bit in the second half of the 20th century. You have the same genes. Most of us have been alive for that second half of I say most of us, most people have been alive for the second half of the 20th century. So if the genes haven't changed, what has? And the answer comes that we found out that our allostatic load, where the stressors, the rocks in our backpack, are doing certain things. Our environment has changed. There's more rocks now. There's more stressors. Our allostatic load is increasing, and that is turning on genes that have never been expressed before. Okay? So the result of that is, as you can see here, they just use type 2 diabetes, but it's through the roof. And we'll see the other chronic diseases later. And the biggest link that we find between all that is inflammation. And inflammation is kind of the root cause of all these chronic diseases. And the inflammation is coming from the fact that we've put more and more rocks into our backpack. We've increased our allostatic load. So that's got to be our main focus. How do we get these rocks out of our backpack? And we need to exercise, and we need to eat better, and we need to stress less. And we'll start removing rocks a little bit at a time and getting closer to homeostasis as we lessen and lessen that allostatic load. So some of the chronic disease rates that they dug into, and I put these in here for you guys because I want you to realize how rampant chronic disease has come while our genes really haven't changed. All right. So if we look at 2001, this is 20 years ago now. All right, 2001, coronary artery disease, 931,000 people, 39% of the population. This is in the United States, okay? We look at hypertension. Less than half of adults have normal blood pressure. That wasn't the case a while ago, a short while ago, all right? But if you look at 21, less than half. And, you know, these numbers aren't getting better at this point because allostatic load continues to climb, chronic inflammation and continues to climb, and we have more rocks in our backpack than ever. Diabetes is up 600% from 1958 to 1993. That's insane. 35 years, right? Yeah, 35 years. 20 million people are currently diabetic. Cancer, 553,000, almost 554,000 deaths in 2001. That's 23% of all the deaths. All right, look at those numbers. Really take those numbers in. Because in 2020, we ran into a pandemic that killed a little over 400,000 people by the end of 2020, right? In the year 2020, 400,000 people, which is less than any number that you see on this board right here. And we shut everything down. Everything. We didn't once talk about how to be healthier. What can we do to defend against a virus? Do we increase vitamin D, probiotics, omega-3? Should we exercise more? Should we stress less? How many more McDonald's, Wendy's, Burger Kings, you name the unhealthy food, went up since 2001? We shut the country down for a year because 400,000 people died. Look at the millions of people who have died from these chronic disease numbers, and we do nothing about it. In fact, we make it worse. We increase the number of rocks in the backpack. And that is the exact reason I do these 12 minutes to health, guys, because these are diseases by lifestyle, right? Look at coronavirus from 2020, and it was weird, and some people were affected differently, and we didn't really understand it, and we shut stuff down. We understand this stuff. We know what chronic inflammation does. We understand the rocks that are in our backpack. And all of that can be changed by making the right decisions, by understanding this research. And that's why I ask you guys to pass this stuff on, because we don't have to die at the rates that we die from these chronic diseases and the chronic inflammation that's occurring. So really take that to heart. Really think about that, guys, because it's a big, big deal. And no one's trying to help us. We're trying to make more money. We're introducing more drugs, more crappy food, all sorts of stuff that's increasing the rocks in our backpack. We've got to start to take some of those out. So write down some stuff that you get from this. Pass this stuff on to your family. Like it, share it, all the stuff that I talk about, right? Children are the future. It's absolutely true. We have the fattest, sickest, dumbest children in history, right? And I don't say that to be mean. I say that because those are facts. All right, we have the most depressed children in history. We have the most children that take their own lives in history. We've got to change it. We've got to remove the rocks. right? I had a patient, this was early on when I started, and I used to do I used to do these kind of talks in my office. They were a little less research based at that time because I was just developing my, research knowledge at the time. But I wanted people to be informed of the information that I had, just being a doctor and living the lifestyle that I live and studying it the way I studied it. So I had a patient come up to me after a nutrition talk that I did, and I had about 20 people there that were patients. And she goes, "This was great. Thank you so much. I'm going to start to make these changes. It's just not easy." She goes, "But could you do one of these for kids? Because my kids are terribly unhealthy as well." And I kind of laughed. I said, "I can, but you're not going to like it." And she said, "Why?" And I said, "Because until you make the changes we talked about tonight, your kids never will. And the changes that they need to make are the exact changes that you need to make. They need to eat better, move more, and stress less. They need to remove rocks from their backpack." And she looked at me and she's like, "Yeah, I can see that." She goes, "If I didn't have chips in the pantry at home, they probably wouldn't eat chips." And I said, "Better yet, if you had strawberries in the fridge and they're hungry, I bet they'll eat the strawberries." So it's the same talk. It's not different for kids, right? We're human beings. We require the same thing. Where the rocks are the rocks, and the rock removal is the rock removal from the backpack. And lessening the allostatic load for children is the same as it is for adults. But the children they're much more impressionable. And if you eat healthy, your kids will eat healthy. If you exercise more, your kids will ask to exercise more. But if you spend more time on your iPad, your kids are going to spend more time on their iPad. It's just the way it works. And there's a responsibility that I think we need to take to lessen the allostatic load for us and for our children so we can curb these numbers when it comes to chronic disease. And, you look at it, we're fighting an uphill battle. There's more fast food restaurants going in today, I promise. There's less healthy places going in today, and they're going to be a little bit more expensive. But Christ, isn't it worth it? I mean, to be healthy, I made the switch a long time ago to go totally organic with all of my diet when possible. It's not always possible, but every time I get the choice between organic and non-organic and another buck or two, I always spend the extra money at this point because it's that important to me. It's more important to me than a TV or a car or a house or anything else. It's my life, it's my health, and it's my kids' health. And I want you guys to take that approach. So we've got to eat better, move more, and manage stress. That's one of the things that we use in our office. Dr. James Chestnut out of Canada, he wrote the book Live Right for Your Species Types. He developed the proprietary health software that we use inside of the office, and he developed the 90-day innate lifestyle plan. So I don't have enough time to go into this all, guys, but it's an online program we run with our patients. We change how they eat, we change how they move, and we change how they think. We remove the rocks from their backpack through an email every day, and they get to do what they want and don't want. And I can tell you this, just by reading the email, you will be more conscious and you will be healthier because of it. It's a great program. Ask questions about it. Give us a call, social media, come into the office on Tuesday nights, whatever it takes to get the answers. Make sure you take advantage of this stuff and look up the book, Live Right for Your Species Type. I'd give you mine, but it's folded and highlighted and underlined and written in and probably wouldn't make a lot of sense to you. So grab a copy of it because it's a hugely important book on how to be healthy and it follows the research each and every day. So guys, I know there's a lot of things that stand in the way of you becoming healthy. A lot of it is just not knowing. A lot of it's convenience, right? A lot of it is money. And that's why we do our special offers. So in our office, we help you get out of pain. We help you get healthy. We start everything with a consultation so we can figure out what are your goals and what are you trying to achieve. Do you have a ton of symptoms and you want to get healthy? Do you want to just get out of pain? We're going to help you realize where the pain came from, the lack of health came from. But it all starts with a consultation, then an exam. We take any x-rays we need to. But one of the biggest things we do, I talked about the proprietary health software. We use a spinal health assessment. And basically it's a functional movement screening and a lifestyle assessment to see, how are you eating, moving, and thinking? What can we do to help? And let's come up with a plan. Now, normally in the office, those services cost about $289, but we've brought that all the way down to just a $39 donation from you to our local monthly charity so that we can get people to get over the excuse of money, to get past any of the barriers that have stopped you from being healthy and continue to add rocks into your backpack. Let's get the rocks out. Come into the office, donate the $39, and we'll put you through this whole system, and we'll see what's going on, and we'll come up with a plan to best help you guys out. So like I said, guys, the biggest thing for me, the reason I lower the cost so much is to spread the word. Let's get the word of health out there. It's simple, and I understand it's not always easy, but we've got to start making the right choices for ourselves because others aren't making them for us. So I thank you guys for joining us again. Give us a call, give me a call, an email, a text, social media, whatever it is, reach out and get those answers because it's time to start living like our species are supposed to. Remove the rocks from the backpack and let's get healthy. And we'd love to be there to help you guys. So thank you, and I'll see you next week for the 12 Minutes to Health. Thanks, guys.